Betty from the USA. Is it very variable to come to your clinic for the first visit? Can the rest of the visits be on the Zoom? How many visits are typical? Thank you very much, Betty, for your question. Well, it is valuable. Well, it is indeed very much recommended, especially I'm looking at your pictures now. You have quite intense residuals and complications, tension, high tone of your facial muscles, synkinesis, and so on. And it would be very much advisable that you visit our clinic at least once. Why? Or maybe twice, at the very beginning, at the very end. Why? Because when the patient is in the clinic, we are doing the measurements. We have an equipment to do to measure the recovery level of your facial nerve. And we can also measure the difference in the mimetic patterns between your healthy and affected side. And I will show it to you on the screen of the computer, what it is not. And then you will understand much better how we can achieve improvements and why improvements are possible and what is the best way. Of course, not everyone can have a possibility to travel to Rotterdam every 10 to 12 weeks. That's the regular, let's say, recommended frequency of your in-person visits. There are also possibilities to work online, fully online, for those who absolutely cannot travel. We do work with those people online, and we have a lot of people from many countries, as I said, more than 100 countries. And there is a hybrid version of the program where you would come for the first visit. Of course, we not only do the measurements, we also do the treatment, by the way, which is very relaxing, harmonizing, and there's the idea to remind your brain, hello, Mrs. Brain, this is how it feels when the face is in harmony. And that is how it feels when the sensory pictures from both sides of the face are symmetrical, and that you can remember and work towards that result when you work at home in between your visits. And then if it's a hybrid version, after the first visit, you work online, 4 working sessions online with the interval, single sessions with the interval of 4 weeks in between. And then you come for the finalizing session for the second time. We do again the measurements and everything. We again do the treatment to fine-tune, to polish all the results and everything. So if you want to visit fully in person, then we always start with 4 visits, and every visit contains 3 daily working sessions. So it's 1, 2, 3, let's say Monday, Tuesday, Wednesday. And then, depending on the results achieved within the 4 visits, we can decide whether additional visits are necessary. But from our experience, it is very, very seldom that more than 6 visits are necessary to achieve aesthetically acceptable result. And those more than 6 visits are usually necessary in the really heavy cases, like after tumors, heavy traumatic damage to the facial nerve, congenital facial paralysis, and so on, surgical interventions. But that is not the case for an absolute majority of facial paralysis cases.